Hi, my name is Dr. Aneez Ahmed, and I'm a senior consultant thoracic surgeon at the International Center for Thoracic Surgery. My main area of practice is thoracic surgery, which includes everything in the chest and also the chest wall with the ribs and the muscles which protect your chest wall. Today, we'll be talking about the bony cage which protects your chest, most of which is formed by the ribs and a little bit by the sternum. Today, our main topic of conversation will be about rib fractures. Surprisingly, rib fractures are quite common in our daily lives because we can have trauma which is innocuous and you may not even know you had it, and there could be a small fracture of the ribs. Or you could have a major accident leading to fracture of the ribs. Ribs, as you know, are thin plastic made of soft tissue bone, and they are quite prone to fractures, but also they heal very well. The most common types of fracture we would say are of two types, the displaced and the non-displaced versions. The displaced means they are totally out of position, meaning more danger to you. The most common cause of rib fractures usually is by direct trauma. For example, you can fall down, hit the road, or a solid moving object can come and hit your chest wall. So it's direct or indirect contact injury, which is the most common cause of fracture of your ribs. There are other rarer causes of fracture of ribs which can happen when you have advanced cancer, and they are called pathological fractures, although they can be quite uncommon in the rib area. Symptoms associated with rib fracture is usually pain, and it is the only most prominent symptom. After the impact or immediate trauma, you can have serious pain. Sometimes you can have a dull aching pain which persists, which is more worrying because you're worrying about something else happening inside your chest, for which you will require an urgent consult. When you have a trauma, the first investigation you will reflexly undergo is a simple chest X-ray. But sometimes chest X-ray doesn't detect all the fractures of the ribs because of the nature of the bone. The most comprehensive test for diagnosing your fracture of the ribs is a CT scan. And nowadays we do an advanced software programming version called 3D reconstruction of your ribs, which will give us exactly where your fractures are, and we will be able to treat it appropriately. Most of the rib fractures are treated conservatively, meaning we give you rest, we give you analgesics, get relief from the pain, and the bone should heal well by themselves. But these are usually restricted to one or two non-displaced rib fractures. When you have 3 or more rib fractures, you will usually require some form of surgical intervention. And if there are displaced rib fractures with underlying organ injury, which is a medical emergency, you will need to come into the hospital for your ribs to fix by using plates. At this point in time, we have the technology using titanium plates to fix your ribs so that you can get back to your normal working life as early as possible. Rib fractures, when they happen, can be innocuous, but they can also be life-threatening. When you have a traumatic injury to your chest, by direct fall or by an indirect object hitting you, it is always wise for you to consult a physician to make sure there is no underlying fractures or other organ damage in your chest. So take rib fractures seriously. Thank you.